Showering. After 70, how often is too much or too little? Essential senior hygiene tips. Have you noticed your skin feeling drier and more irritated lately, even though you're keeping up with your regular shower routine? If you're over 70, what worked for decades might actually be causing harm right now. Your doctor probably never mentioned this, but the showering habits you've followed your entire life could be stripping away your skin's natural protection, leading to painful itching, cracking, and even serious infections. Here's what's shocking. Dermatologists say that most seniors are making critical mistakes in the bathroom every single day, and these errors are completely preventable. The confusion is real, because we've been told our whole lives that cleanliness matters, but aging skin operates by entirely different rules. Your body's needs have fundamentally changed, and continuing old patterns without adjusting could be sabotaging your health and comfort. The truth about proper bathing after 70 will probably surprise you, and understanding this one aspect of daily care can dramatically improve your quality of life. In the next few minutes, you'll discover exactly how to protect your skin while maintaining proper hygiene after 70. We'll reveal the science-backed showering frequency that dermatologists recommend specifically for aging skin, and why this number might be lower than you think. You'll learn 5 critical mistakes that accelerate skin damage and how to avoid each one starting today. We'll share 3 alternative cleaning methods that keep you fresh between full showers without compromising your skin's protective barrier. You'll get the complete list of products you should immediately stop using and the gentle alternatives that actually work for mature skin. We'll explain the optimal water temperature range backed by research, plus the exact duration your showers should last for maximum benefit. You'll discover 4 warning signs that indicate you're bathing too frequently or not enough, so you can adjust your routine accordingly. We'll cover essential safety modifications that prevent the bathroom accidents that send thousands of seniors to emergency rooms annually. By the end, you'll have a personalized showering schedule that fits your lifestyle, activity level, and specific skin needs. This isn't generic advice. These are practical solutions designed specifically for bodies over 70. Why showering changes? After 70, your skin undergoes profound transformations as you age, fundamentally altering how it responds to water and cleansing products. After 70, your epidermis becomes significantly thinner, losing approximately 20% of its thickness compared to younger years. This thinning makes your skin more vulnerable to damage from environmental factors, including the very water meant to clean it. The sebaceous glands that produce natural oils slow down dramatically with age. These oils form a crucial protective layer called the acid mantle, which shields your skin from bacteria, pollutants, and moisture loss. When oil production decreases, your skin loses its primary defense mechanism, leaving it exposed and fragile. This is why you might notice that areas which never felt dry before now feel tight and uncomfortable after bathing. Cell turnover, the process where your body sheds dead skin cells and generates fresh ones, decelerates significantly in your 70s. Young skin completes this cycle approximately every 28 days, but senior skin can take 45 to 60 days or longer. This slower regeneration means damage accumulates faster than your body can repair it, making every harsh shower a setback rather than a refresh. Your skin's ability to retain water diminishes substantially due to reduced production of natural moisturizing factors. Compounds like ceramides, fatty acids and cholesterol that lock hydration into skin cells. Without adequate levels of these elements, water evaporates rapidly from your skin's surface, leaving it dehydrated even immediately after bathing. This creates a paradox where the act of showering actually dehydrates you. Blood circulation to the skin decreases with age, meaning fewer nutrients and less oxygen reach your skin cells. This compromised circulation impairs your skin's ability to maintain its barrier function and heal from minor abrasions caused by washing. Additionally, collagen and elastin fibers break down, reducing skin elasticity and making it more prone to tearing from simple friction with washcloths or towels. Understanding these biological realities explains why your lifelong bathing routine now produces different results, requiring a thoughtful adjustment to protect your changing body. Excessive bathing strips away the lipid barrier that serves as your skin's first line of defense against the outside world. Each time you shower, hot water and soap dissolve these essential fats, and when you bathe too frequently, your body cannot replenish them fast enough. This creates microscopic cracks in your skin's surface, allowing irritants, allergens and pathogens to penetrate deeper layers where they trigger inflammatory responses. Daily showering, especially with hot water, disrupts your skin's pH balance. Healthy skin maintains a slightly acidic pH of around 5.5, which inhibits harmful bacterial growth while supporting beneficial microorganisms. Frequent exposure to alkaline soaps and prolonged water contact shifts this pH toward neutral or alkaline levels, creating an environment where problem-causing bacteria thrive while protective bacteria struggle to survive. Overwashing directly contributes to xerosis, the medical term for abnormally dry skin that affects over 75% of people over 70. This condition manifests as severe itching, flaking, and visible scaling. The constant itch-scratch cycle damages skin further, creating open wounds that become entry points for infections. Many seniors develop a condition called asteatotic eczema, characterized by a distinctive cracked appearance resembling dried riverbeds, caused specifically by excessive bathing and inadequate moisturizing. Frequent showering compromises your skin's microbiome, the diverse community of beneficial bacteria, fungi, and other microorganisms living on your skin's surface. These organisms play vital roles in immune function, wound healing, and protection against pathogenic invaders. When you wash too often, you eliminate these helpful allies faster than they can recolonize, leaving your skin vulnerable to infections like cellulitis, folliculitis, and fungal overgrowth. Your immune system suffers when skin integrity is compromised. The skin functions as a physical and immunological barrier, housing specialized immune cells that detect and respond to threats. Damaged skin from overbathing weakens these defenses, making you more susceptible to systemic infections. Studies show that seniors with compromised skin barriers experience higher rates of hospital-acquired infections and slower recovery from illnesses, demonstrating how bathroom habits directly impact overall health outcomes. Insufficient bathing allows harmful bacteria, fungi, and yeast to accumulate in body folds and warm, moist areas like the groin, underarms, and beneath breasts. These microorganisms multiply rapidly in unwashed skin, producing enzymes that break down sweat and oils into irritating compounds. This bacterial overgrowth increases your risk of developing intertrigo, a painful inflammatory condition causing redness, burning, and oozing lesions in skin folds that can become severely infected if left untreated. Seniors who bathe infrequently face elevated risks of urinary tract infections, particularly common among older adults due to age-related changes in bladder function and immune response. Poor perineal hygiene allows fecal bacteria to migrate to the urinary tract, causing infections that can progress to kidney involvement or sepsis. For individuals managing incontinence, inadequate cleansing leads to incontinence-associated dermatitis, where prolonged exposure to urine and feces causes skin breakdown, creating painful open sores vulnerable to secondary infections. Neglecting proper hygiene permits the build-up of dead skin cells, sebum and environmental pollutants that clog pores and hair follicles. This accumulation creates ideal conditions for bacterial colonization, resulting in infected follicles, boils and abscesses that require medical intervention. The feet are particularly susceptible, where moisture trapped between toes combined with inadequate washing fosters athlete's foot and toenail fungus, conditions notoriously difficult to eliminate once established. Beyond physical health, inadequate bathing carries profound social and emotional consequences. Body odor from bacterial breakdown of sweat becomes increasingly noticeable to others, potentially causing friends and family members to distance themselves. This social isolation exacerbates loneliness and depression, already prevalent concerns among older adults. Many seniors report feeling embarrassed about their appearance or smell, leading them to decline social invitations and withdraw from activities they once enjoyed. The psychological impact extends to self-esteem and dignity. Feeling unclean affects how you perceive yourself, diminishing confidence and creating a negative self-image. Family members may become concerned, sometimes interpreting poor hygiene as cognitive decline or inability to care for oneself, triggering conversations about assisted living or increased supervision that feel invasive and demoralizing. Maintaining appropriate cleanliness preserves independence and signals to others that you remain capable of self-care, protecting both your health and autonomy. Dermatologists specializing in geriatric care recommend that most adults over 70 shower 2 to 3 times per week for full-body bathing. This frequency balances hygiene needs with skin protection, allowing your natural oils sufficient time to regenerate between washes. Research published in the Journal of the American Academy of Dermatology confirms this schedule minimizes skin damage while maintaining adequate cleanliness for healthy seniors with typical activity levels. However, certain body areas require daily attention regardless of full shower frequency. The groin, underarms, feet and any skin folds need washing every day to prevent bacterial accumulation and odor. You can accomplish this with targeted cleansing at the sink using a washcloth, warm water and minimal gentle cleanser. This approach addresses hygiene priorities without subjecting your entire body to water exposure that depletes protective oils. Your individual circumstances significantly influence optimal bathing frequency. Seniors with active lifestyles involving regular exercise, gardening or outdoor activities may need to shower more frequently, potentially 4 times weekly. Conversely, those with limited mobility or sedentary routines can often maintain excellent hygiene with twice-weekly full bathing supplemented by daily spot cleaning. Medical conditions also factor into decisions. Individuals with diabetes require meticulous foot hygiene, while those with eczema or psoriasis may need customized schedules developed with their dermatologist. Climate and seasonal changes demand routine adjustments. During humid summer months, increased perspiration necessitates more frequent bathing, possibly shifting from twice to 3 times weekly. Hot weather also means more time outdoors, accumulating dirt, sunscreen and insect repellent that require a thorough removal. Winter presents opposite challenges. Indoor heating and cold outdoor air dramatically reduce humidity levels, accelerating skin dehydration. Many seniors find that reducing shower frequency during winter months, perhaps to once or twice weekly with enhanced spot cleaning, significantly improves skin comfort and prevents the severe dryness that plagues colder seasons. Living environment matters considerably. Those in air-conditioned spaces stay cooler and perspire less, requiring fewer showers than seniors in homes without climate control. Geographic location plays a role too. Residents of dry desert climates need different bathing schedules than those in humid coastal regions, where moisture retention poses different challenges. Water temperature significantly impacts skin health, yet most people shower in water far too hot for aging skin. The ideal temperature range falls between 98 and 105 degrees Fahrenheit, barely warmer than body temperature. If your bathroom mirror fogs heavily or your skin turns bright red during showering, the water is too hot and actively damaging your skin barrier. Lukewarm water feels less satisfying initially, but it cleanses effectively without stripping essential moisture. Test temperature with your elbow or forearm rather than hands, as these areas provide more accurate sensitivity readings. Shower duration matters as much as temperature. Limit full-body showers to 5 to 10 minutes maximum. Prolonged water exposure, even at appropriate temperatures, swells skin cells and disrupts the lipid matrix holding them together. Set a timer if necessary. Many seniors underestimate how long they spend in the shower, sometimes remaining underwater for 20 minutes or more out of habit, or because the warmth feels comforting. Product selection requires careful attention to ingredients. Abandon traditional bar soaps, which contain harsh surfactants with pH levels around 9 or 10 that severely disrupt your skin's natural acidity. Instead, choose fragrance-free, soap-free cleansers labeled as pH-balanced or specifically formulated for sensitive skin. Look for products containing ceramides, glycerin, or hyaluronic acid, ingredients that clean while depositing moisturizing compounds. Avoid anything listing sodium lauryl sulfate, alcohol, or synthetic fragrances high on the ingredient list, as these components cause excessive drying and irritation. Washing technique requires gentleness rather than vigorous scrubbing. Use your hands or an extremely soft cloth instead of loofahs, brushes, or rough washcloths that create micro-tears in delicate aging skin. Apply cleanser only to areas that genuinely need it, underarms, groin, feet, and skin folds, rather than soaping your entire body. Many body areas rinse clean with water alone, especially arms, legs, and torso, where oil glands are less active. Pat skin dry with a soft towel immediately after showering rather than rubbing vigorously. Rubbing creates friction that damages vulnerable skin and removes more moisture than necessary. Leave skin slightly damp rather than completely dry. Then apply moisturizer within 3 minutes of exiting the shower. This timing is critical. Damp skin absorbs moisturizer more effectively, and immediate application traps water in your skin before evaporation occurs. Choose thick creams or ointments over lotions, as these formulations create better barriers against moisture loss. Safety considerations. Bathrooms account for nearly 80% of home falls among seniors, with the majority occurring during or immediately after showering. Wet surfaces combined with balance changes, reduced muscle strength, and potential dizziness from temperature shifts create hazardous conditions. Installing non-slip mats both inside the tub or shower and on the bathroom floor provides essential traction. Choose mats with suction cups that grip firmly rather than fabric versions that bunch or slide, and replace them when suction weakens. Grab bars represent the single most effective fall prevention modification you can make. Mount them strategically at entry points to your shower or tub, and ensure they're anchored into wall studs rather than just drywall. A vertical bar near the shower entrance assists with stepping in and out, while horizontal bars inside provide stability during washing. Position bars at heights matching your natural reach, typically between 33 and 36 inches from the floor, and have them professionally installed to support at least 250 pounds of force. Shower chairs or transfer benches eliminate the need to stand throughout your entire shower, dramatically reducing fall risk. Transfer benches extend from inside the tub to outside, allowing you to sit and swing your legs over the edge rather than stepping over the high tub wall. Adjustable height shower chairs accommodate different body sizes and mobility needs. Even if you feel steady on your feet now, having seating available prevents fatigue during longer hygiene routines and provides security if you experience sudden weakness or lightheadedness. Consider replacing traditional shower heads with handheld models attached to adjustable sliding bars. These allow you to direct water exactly where needed while seated, eliminating awkward reaching or twisting that compromises balance. Handheld sprayers also enable more thorough rinsing with less effort and better control over water contact with sensitive areas. Adequate lighting prevents missteps and helps you see potential hazards. Install bright LED bulbs, providing at least 100 watts equivalent illumination, and consider motion-activated nightlights for nighttime bathroom visits. Eliminate throw rugs that create tripping hazards and ensure towel bars are decorative only. Never use them for support, as they're not designed to bear body weight and will pull free from walls. Recognize when requesting help demonstrates wisdom rather than weakness. If you've experienced previous falls, have significant balance issues, or feel unsteady during transfers, having someone present provides crucial safety backup. Many seniors arrange for family members or caregivers to remain nearby during showers, not necessarily providing hands-on assistance, but available immediately if problems arise. This precaution can mean the difference between a minor slip and a catastrophic injury requiring hospitalization. Alternative cleaning methods. Sponge bathing offers a highly effective compromise between full showers, maintaining cleanliness while protecting your skin's integrity. This method involves washing at the sink using a basin of warm water, a soft washcloth, and minimal cleanser. Start with your face, then move systematically to neck, underarms, torso, groin, and feet, areas where bacteria and odour concentrate. Rinse the cloth frequently and change water halfway through to avoid redistributing dirt. This approach takes only 10 minutes, yet addresses all critical hygiene zones without the dehydrating effects of full-body water immersion. Strategic spot cleaning targets specific areas requiring daily attention while sparing the rest of your body from unnecessary washing. Focus on the hot zones where sweat glands cluster and bacteria thrive: armpits, groin, buttocks, underbreasts, and between toes. Use individual pre-moistened cleansing cloths for each area to prevent cross-contamination, or dedicate separate washcloths for different body regions. This selective approach maintains freshness and prevents odour while preserving protective oils on your arms, legs, back and chest where they're most needed. No-rinse cleansing products revolutionize hygiene for seniors with mobility limitations or those seeking to minimize water exposure. These specially formulated cleansers contain gentle surfactants that lift dirt and bacteria without requiring rinsing. Apply them with a cloth, wipe away residue with a clean cloth, and you're done. Medical-grade versions used in hospitals prove these products effectively clean while being gentler than traditional soap and water combinations. They're particularly valuable during cold weather when frequent showering becomes especially drying. Dry shampoo extends time between hair washing, which can be exhausting for seniors with limited arm strength or mobility. Spray or powder formulations absorb scalp oils and refresh hair without water. Apply to roots, wait 2 minutes for absorption, then brush through thoroughly. This technique allows you to wash hair weekly rather than with every shower, significantly reducing overall bathing frequency. Body wipes designed specifically for adults provide convenient cleansing between showers. Unlike baby wipes, adult cleansing cloths are larger, thicker, and formulated for mature skin with pH-balanced solutions. Keep them at room temperature rather than refrigerated for greater comfort. Individual packets ensure freshness and allow discreet cleaning anytime you feel the need without committing to a full shower. Antimicrobial powders applied to feet, groin and underarms absorb moisture and inhibit bacterial growth, keeping these areas fresh longer. Choose cornstarch-based products over talc, which has raised health concerns. Apply after morning spot cleaning to maintain dryness throughout the day, reducing the urgency for frequent full bathing. Finding the right showering balance after 70 isn't about following rigid rules. It's about understanding your body's transformed needs and responding with informed flexibility. 2 to 3 full showers weekly, combined with daily spot cleaning of critical areas, gives you the hygiene you need, while protecting the skin barrier you can't afford to lose. Adjust based on your activity level, season, and how your skin responds, because you know your body better than any generalized advice ever could. Your bathing routine directly influences your comfort, health, and independence in ways that extend far beyond simple cleanliness. Skin integrity affects infection resistance, mobility safety impacts your ability to live independently, and maintaining proper hygiene preserves the social connections that make life meaningful. These aren't minor details. They're fundamental aspects of thriving in your 70s and beyond. If this information changed how you think about your daily routine, share it with someone who needs this guidance. Your experience and the lessons you apply could improve another person's quality of life dramatically. Settings. Add all-caps subtitles with a spoken word. Highlight. Use YouTube audio library, only use appropriate media. Use a male old husky British voice for the narrator.